Right. Good morning. Welcome to our webinar with Encompass Michigan. We have a long-standing partnership with MIOSHA. We have received a fiscal year 2024 Consultation Education and Training Grant Award from MIOSHA. So we're really grateful for their support as we continue to provide health and safety training opportunities to community rehabilitation organizations across the state. Supporting our members and maintaining a safe and healthy work environment for staff as well as persons served is a top priority for the association, as you know. So we appreciate the opportunity to present today's webinar on MIOSHA record keeping and the updated electronic submissions rule. I'm pleased to introduce our presenter, Deb Zeal, Senior Occupational Safety Consultant in the SET Division of MIOSHA. Welcome, Deb. Thank you so much for joining us today.
Okay. And here we are. So I was asked to go ahead and give you a brief overview of record keeping along with an update on the new electronic submission information. And it's really not that surprising. The new stuff is not that surprising. We're going to get to that closer to the end of the presentation. When the original change came out, for those of you that remember back in 2018, give or take, right around there, they proposed sending in all three, the 300, 301, 300A information back at that point, but they couldn't get a software system that would do everything that they wanted it to do. And then we had some government changeover, and we kind of stopped at the 300A submissions. Well, over time, we've gotten to the place where federal OSHA has a system that can take some more information, that 301, 300A, that's going to be coming out. Well, it is out. So those that are impacted are going to have to send in all three forms. You're still using the same sign-ins, you're still using the same information, but they are asking for those two additional forms. And there's some requirements that you take some information out of that as well. So I'm going to go ahead and just recap some of the things that we see in record keeping, and then we'll get to the electronic submission closer to the end. So our objectives, discriminate between recordable and non-recordable workplace injuries, and talk about the 300, 301, and 300A forms. Number one thing to remember is that not everything is going to be going onto your 300 log. Just because you're going to pay for an employee potentially to go to the doctor, it doesn't mean that every single time we send someone to the doctor, it's going to show up on the log. It also doesn't mean that if you don't send someone to the doctor, that it wouldn't end up on your log. They are two separate things, although often they go hand in hand. It's good for you to know the requirements for both recordability and compensability. And so majority of what we're talking about today is recordability. So when we're talking about a recordable injury or illness, it means that you had an injury or illness that meets the recording criteria and it resulted in death, days away from work, restricted work activity, transfer to another job, medical treatment beyond first aid, or a loss of consciousness. Regardless if they went to the doctor on the loss of consciousness, if it was caused by the work environment, you're going to record that. So in order to have a recordable case, it has to have three legs. All three legs must be there in order to hit the recording criteria. It must be work-related or significantly aggravated by something in the work environment. It has to be a new case, and we're going to talk about what a new case is. And it also has to meet the recording criteria. Those are covered in Rules 1112 through 1119 of our Part 11 record-keeping standard. We have our own numbers in the state of Michigan, but really our standard is pretty much an adoption of the federal standard. There's very, very few changes, except for it looks a little different. The verbiage is all there. What it covers is all there. So if you have an organization that has Michigan facilities as well as federal facilities, you'll see that the 1904 information compared to our Michigan information looks differently, but if you do a side-by-side comparison, it's pretty much an adoption here in the state of Michigan as well. So A couple things to remember. If you have an employee that is injured in your parking lot, once they leave their car, 1 foot out of the car and they trip in a pothole or on ice or anything along those lines, you are going to be recording those on your log if it hits the other recording criteria. So that is often a question. We live in the state of Michigan, so there are, every year there's things that happen in our parking lots. If it is a person outside of their vehicle in a path that you expect them to take to come into the facility before they punch in or after they punch out, that is still going to be a recordable situation. If you have an employee that is struck by a vehicle, or there's a vehicle to vehicle accident, that is the exception to the injuries that happen in your parking lot. Another thing for you to remember is that if the work environment significantly aggravates a pre-existing condition and results in any of the following bullets, the death, loss of consciousness, the days away from work, etc., then you're going to put those things on the log. Couple of examples: if you hire someone who has mild carpal tunnel, for example, but you put them on an assembly line where they're doing a lot of repetitive motion activity with their wrist, you may have taken a mild case of carpal tunnel and made it significantly aggravated, and it got worse. That would go on your log after the diagnosis and the treatment. Another one to consider is that if you have people with epilepsy, that's a pre-existing condition. If you have strobing lights in your environment that would trigger a reaction, it may be something that you're going to be putting on the log. I would talk to your consultant, or you can call MIOSHA and discuss, is this something that goes on our log? We do have a department that 40 hours a week, Monday through Friday, they answer all of your record keeping questions. But think about if there's something in the work environment that may have triggered a pre-existing condition, and if the answer is yes, it goes on the log. Travel status. We get more and more people that are in travel status. If there's an injury that occurs while the employee was in travel status and performing a job in the interest of the employer, and it results in an injury, it will be something that you would put on your log. Here's an example. You have a work activity where, for example, I'm a consultant. I work out of my home and I go to different locations every single day. As soon as I get into the work vehicle and I go to a host location, anything that happens to me from the time that I get in the vehicle to the time that I get to the host location to the time that I get back out of my vehicle, if I'm performing work in the interest of the employer and I am injured during any part of that, that is something that would go on the log. If you have, and we have a lot more people since COVID that have, I'm sorry, I'm jumping slides. Home away from home. If you have people that are in travel status and they go to a hotel, anything that happens in the hotel itself, if they're injured, would not necessarily go on the log unless they were doing something in the interest of the employer. An example of that is they're in the hotel room and they're walking through the door and they stub their toe. Well, nothing that they were doing at the time was in the interest of the employer. The employer had no control over that. On the other hand, if they were carrying a box of paperwork into the hotel room and they couldn't see where they were going because the box was so large and they stubbed their toe and ended up with a broken toe or something that hit the recording criteria, they were doing something in the interest of the employer at the time that that injury happened. So that would be something that would go on the log. So you have to be investigators to figure out if it's going to go on the log or not. My example of being a personal consultant, if I go from my home to a host employer and on the way back home, I decide that I need to stop at Meijer's and grab milk, and I slip and fall in the Meijer parking lot, I wasn't at Meijer's in the interest of the employer at the time, so that would not be something that would show up at the log. So those are things that you're going to have to ask questions for as you're determining if things are recordable or not when you have people on travel status. Now, to jump to, since we've had COVID, we had a large population of our workforce start working at home. And I'm going to go back to what I said on the travel status. If the employee gets injured while they are performing something in the interest of the employer, you have somebody who's doing data entry all day and they have developed carpal tunnel, there's a pretty direct correlation with that. If they have an electrical fire, in the outlet that they have the computer plugged into that that you as the employer provided for them, their house electrical issues aren't anything that you're going to have control of. So that would not be something, if they were injured in the result of that fire, that turned into something that would be potentially recordable. It wouldn't be, because you had no control over their electrical in their facility, in their house. If they tripped over their dog, even if it was during working hours, your dog has nothing to do with work performance. On the other hand, if they were getting a large box out of their trunk that was all work related, or you mailed them a 60-pound box of materials and they threw their back out, that would be work related. So you have to, again, be a little bit of an investigator. So those are some of the things that could potentially be work related. Some of the oddball cases that we're trying to determine if they're work related or not. The second bullet that we needed to satisfy was it a new case? Okay. So a new case means that someone comes to you and reports that they're feeling pain or have an injury or illness, and it's an all new case. You've never heard of it before. It's the same body type, or it's a body type that they've never reported. They come to you and say, my right wrist hurts. I think I have carpal tunnel. The doctor agrees. They have to go through therapy. They get prescription pills, whatever the case may be. It's going to go on the log. It's a new case. You've never heard of it before. But using that same example of, I have this right wrist that I've already been diagnosed with carpal tunnel, and it was a case on last year's log. I got surgery. I did all my follow-ups. The doctor released me 100%, and I went back to work without any restrictions or transfer or anything along those lines. Once the doctor 100% releases that employee, if they come to you 2 months later, 2 weeks later, 2 years later, whatever the case is, when the doctor released them 100%, it becomes a new case. So that can happen within months, that can happen within a year, that can happen within several years. But if the doctor determines that, yes, they again have carpal tunnel, it was significantly aggravated or caused by the work environment, regardless of how much time has passed in between, once they were released 100% and they were re-diagnosed, it becomes a new case. Unless you can get a doctor to put on paper that they made a mistake. That's not typical of what I've seen happen in the past, though. So we've covered what would be covered as far as work-related. It has to be work-related. Significant aggravation could be something that happens on travel status or at home or in your parking lot. And then the obvious criteria of it happened at work. But then we also needed to satisfy the new case and the general recording criteria. So if you send an employee to the doctor because they have a work-related injury or illness, it hits the new case because the doctor agrees, and it results in death, days away from work, restricted work or transfer to another job, medical treatment beyond first aid, loss of consciousness, or other significant injury or illness diagnosis, is going to show up on your log. So if you send an employee to a doctor and they determine that they need to have days away from work, when you look at your 300 log, you begin counting the day after you send them to the doctor or that they've had that injury. A simple example is you have an employee that shows up and they have a significant laceration on their finger. You send them to the doctor, they get stitches. The doctor says, don't go back until tomorrow. That's not a lost time case. Even if it happened at 7 o'clock in the morning and they don't come back until 7 o'clock the next day, that would not be a lost time case. If the doctor says you don't need to take a week off because for whatever reason, they don't want you bending that finger, things along those lines, then you begin counting the day after the injury occurred. Okay, don't count the day of the injury, start counting the day after. All calculations on the log are on calendar days. So it doesn't matter if it's Christmas, it doesn't matter if they're scheduled to work, it doesn't matter if it's the weekend, it doesn't matter. The first full day that they miss is the first day that you count, and you count the calendar days until they come back. So you count up until the day before they actually come back. You cap that number at 180 days for the statistical part of record keeping. You don't have to keep counting. Your workman's compensation cares if it goes above 180. What OSHA and BLS have learned over time is that at 180, the chances of them coming back to work are significantly lower. So they become they become insignificant to the statistics above 180 days. So you're still counting for your workman's compensation, but you don't have to count on your record keeping. Perhaps you send somebody to the doctor and they get work restrictions. So what is a work restriction? If you have an employee that is unable to perform all routine tasks or cannot work a complete day, that is a work restriction. If you have a physician or licensed healthcare practitioner, an LHCP, recommending that the employee not perform one or more of their routine job functions, that is a restricted work activity. MIOSHA and federal OSHA have defined a routine function as something that the employee would normally do within a 7-day period or once a week. Again, everything that our calendars go up to are in the calendar days. It's not in, are they going to work? Is there a holiday? It doesn't matter. It's calendar days. If you have an employee that because of their work-related injury or illness that needs to be assigned to another job, you can do that, but you still need to record that they are going to be assigned to another job. If it takes you a week, you put a week, 7 days onto your log. If you decide immediately that because of the restriction, you're going to permanently transfer someone to another job, it must be a permanent transfer, which means that as soon as they're healed, you don't just throw them back into it. They have to bid into it, or they have to go through a normal process that anybody who would be interested in that other job would go through. But you can make that determination as soon as you get those restrictions to transfer them to another job completely. You still have to record at least 1 day on your log that you're making that transfer because of the injury or the illness. And then we get into medical treatment. So this is where, what is medical treatment? Medical treatment means that you are sending somebody for management and care to combat a disease or disorder. For that purpose, these rules cover some things. It's not going to include any observation or counseling. It is not going to include diagnostic purposes. It is not going to include first aid. So before I jump into first aid treatment, if you send someone to the hospital because they're having a hard time breathing and they are going to observe or they're going to diagnose if there's anything going on with that employee, they're at the hospital. You sent them because you think it might be work related, but during that observation, counseling, or diagnostic stage, it is not a recordable. The results of the observation, the results of the diagnostics, they had an x-ray, it came back not broken, you're going to pay for the x-ray, but it doesn't go on the log unless there was a prescription given for something else, etc. So if it's just diagnostic, if it's just an observation, you are not putting those on the log, even though you sent them to the doctor. And then we get into first aid. So medical treatment is anything that's not first aid. And there is an all-inclusive list in the standard that covers everything that is first aid. So I'm just going to run very quickly through the list. Non-prescription medication at non-prescription strength. The doctor says, go take 400 milligrams of ibuprofen. That is over-the-counter strength. Therefore, it is not a prescription. If they, on paper, say, go home and take 800 milligrams of your over-the-counter ibuprofen, well, that's prescription strength. It's unlikely they're going to do that. They're probably going to provide a prescription for the 800 milligrams, but if it's written down that it's above the over-the-counter strength, it becomes medical treatment. So first aid, if it's over-the-counter strength, and medical treatment, if it's above the over-the-counter strength. If they administer a tetanus shot, it's first aid. Cleaning, flushing, or soaking of wounds in and of itself, just first aid. Bandages, Band-Aids, gauze pads, butterfly bandages, or steri strips are all first aid. Hot and cold therapy, non-rigid means of support. So to be clear, that's like an ACE bandage, and that's all they did in comparison to, you can even go to Walgreens and Walmart and buy one of those wristbands that have like a single or two metal rods that'll keep your wrist supported. As soon as the rigid support comes in, that's when it turns into, even if you provided it, that's when it turns into medical treatment. So non-rigid, something like an ACE bandage, as soon as you put those rigid supports in, it becomes medical treatment. Temporarily immobilizing devices, you put them in a sling just until you get it diagnosed. Drilling of a fingernail is first aid treatment. Eye patches, the removal of a foreign body from the eye using only irrigation or a cotton swab would be first aid treatment. As soon as they grab tweezers or anything hard, it becomes medical treatment for the eyes. Unlike if you had a sliver and they grabbed a pair of tweezers to pull that out. So splinters or other things in other areas of your body, your fingers, your arms, etc., that's still first aid treatment. So the difference is if they take tweezers to the eye, it's going to be medical treatment. If they take tweezers to pull out something and they're not giving stitches or anything else, that's first aid treatment. First aid guards, finger guards are going to be first aid. Massages, the drinking of fluids to relieve heat stress, these are all first aid treatments. If you have an employee that has a situation that occurs at work, they bent over, they bumped their head on the table, and they passed out for 30 seconds. It is recordable, okay? Something happened at work. They don't want to go to the doctor. They don't want to get checked out, but they were witnessed or they reported that they passed out for some period of time. It automatically goes on your log. Sometimes we're going to send someone to the doctor. I'm not saying in every situation, but if these situations occur, if you have someone who is diagnosed with cancer, another chronic irreversible disease like asbestosis or silicosis, if they have any fractured or cracked bones, because they're probably not going to put a cast on a pinky toe, or if you have a punctured eardrum, regardless if they're treated or not, these would all be considered significant diagnoses and would automatically go onto your log. Needle sticks. So automatically, if you had blood-to-blood transfer, if you're working in a lab with live animals, if you are working with patients or janitorial services where there was a blood-to-blood contact with sharps or needles, so it went from one body into another, it automatically becomes a recordable. Unlike if you have a splash or if you have other exposures, inadvertent contact with one of your routes of entry, hangnails, eyes, nose, mouth, etc. It is only going to become recordable if you continue to test that employee and a bloodborne pathogen comes out of it. If a bloodborne pathogen does come out of it, it automatically at that point does become a recordable injury. It would go on your log. You would record all needle sharps and bloodborne pathogen injuries as privacy cases on your log, and then have a separate private confidential 300 log that would cover the names and everything else, but that's very tightly held for whoever's doing those logs, the injured employee and injured employees' access, as well as the government. If you go to the all-day class, I'll tell you who has access to that in more detail, but the privacy cases are intended to be private for a purpose. There are some additional needle stick criteria that you can find in the bloodborne pathogen standard number 554. We're not going to get into that today. If you hire temporary employees from a work staff agency, etc., we're not talking about contractors. We're talking about temporary staffing employees. So your Manpower or Kelly Services or whatever services are out there. And you provide them day-to-day supervision. All of their injuries that hit the recordable requirements would go on your log. You count them as your employees and you count their injuries because the injury happened under your day-to-day supervision in one of your establishments. You own the hazard, you own the contract with the employee, it goes on your 300 log. Again, recordable and compensable are two different things. Probably the temporary service is paying for any of the injuries, the compensability part, but it goes on your log. So the forms that you need to fill out if you have an employee-employer relationship and one of your employees get injured is the 300, which is the list of injuries that have occurred, your 301, and you can use an equivalent form for any of these, but they have to have everything that we have on these forms required. So maybe you have an insurance agency that has all of these forms. Just make sure that if it's not looking exactly the same, it does ask all the same questions, and you can always ask more on a different form, but you at least have to fill out this much information. So the 301 is your incident investigation, and then your 300A is your summary sheet. On each of these forms, you must enter each of the reportable injury and illnesses on the 300, the list, and then the 301, or the incident report, within 7 days of being notified of a workplace injury or illness. Sometimes you want to do an investigation because you don't really think that this is a work-related scenario. You have 7 days to make that determination. If at the end of 7 days you cannot figure out if this is something that is work-related or not, it automatically goes on the log. You can document your way back out of that, but within 7 days from the time that you are notified that an employee believes they have a work-related injury and it was agreed upon by the doctor, you have to put that. It's going to be presumed that it was work-related, and you have 7 days to document why you wouldn't put it on the log, or it automatically goes there. You can use forms on a computer, and that's fine. You don't have to have physical hard copies. Your Form 300 must be posted. Your summary sheet must be posted from February 1st through April 30th each year after the year that we just finished off. So it gives you a month to review your information before you post it. Again, the 300A is the summary sheet. The 300A is the summary sheet that most of you are already turning into federal OSHA for electronic reporting. So it's just the summary. Those are just the raw numbers, what's going on in your house. How many recordables did you have? How many lost times? How many transfers, etc. You have to keep those forms for a minimum of 5 years. If you've ever had the pleasure of seeing a MIOSHA enforcement officer, they will ask you for 5 years of your 300 logs. Do not send copies to MIOSHA unless you were specifically asked to do so, typically by certified mail. You do have to allow access to those 300 log records to the government agencies, so the health department, MIOSHA, your workman's compensation has access to it. If you have an employee that has gotten a lawyer, you can give access to them. Obviously, your workman's compensation insurance companies, because they're paying for it. But it's pretty limited who you would allow access to. That was all of the recording information. Not everybody has to record. I mean, there are some exceptions. And if you go to the all-day class that I give, we can go through who's exempted from doing all of the recording. But every employer, even if it's just 2 people, every employer must report to MIOSHA any fatality that happens within 8 hours. They also must report any inpatient hospitalization, amputation, or loss of an eyeball within 24 hours of those things occurring within their employer-employee relationship to MIOSHA. There are 2 different phone numbers that you would need to call, and we also have the 8-hour phone call for the fatalities is a mandatory. If you don't have it written down somewhere easy, it's on your job poster for the right to work, the MIOSHA posters. It's much easier to find if you have it jotted down in your policy or procedure. The fatality number is 800-858-0397. It doesn't matter what day you call. We have a supervisor taking every phone call on Christmas Day. There's not a day or a time that we aren't answering that phone number. Again, if you have a hospitalization, a work-related amputation, or a loss of an eyeball, it's a different phone number. And we also have an online form that you can fill out. So you can either call the 844-464-6742, or you can fill out at this website link, the michigan.gov for record keeping. It will give you the information that you need to fill out online. Now to the part that everybody wanted to talk about, the electronic submissions. So if you go to OSHA.gov into reporting, just like you have for every other year, you're going to go into their electronic reporting system. In July of 23, OSHA said we have a final rule that's going to be amended, and all the things that we wanted to do back in 2018 are finally going to occur in 2024. So the final rule supports the agency's mission to assure a safe and healthful working condition for working people. The federal rule went into effect, and all of the reporting requirements went into effect for federal states on January 2nd of 24. Here in the state of Michigan, we officially adopted and are requiring all Michigan employers that hit the criteria to report into the system, but we adopted that on February 13th, 24, effective immediately. Okay, so here's what you need to know. If you have less than 20 employees, you do not need to submit anything unless you were specifically asked to do so by BLS or MIOSHA, but that's not likely, okay? So less than 20 employees, you still do not have to electronically report for your 300A. If you fall into the category of 20 to 249 employees and your organization's NAICS code is found on Appendix B, then yes, you have to fill out the electronic form and send in your 300A. Appendix B did not change significantly, so if you've been doing it since 2018, you're just going to continue to do it. And then, of course, if you have more than 250 employees, regardless of your NAICS code, you do have to send in your 300A. Moving on to now these new requirements, the 300 and the 301. If you have less than 99 employees or less during the whole year, you don't have to send in your 300, okay? But if you have 100 or more employees and your NAICS code is found on Appendix C, you have to send in your 300 forms, the actual listed forms. And exactly like the one above for your 301s, if you have 99 or less, you don't have to send it in. If you have 100 or more and you're on Appendix C, you have to send in your 300 and your 301. So that did not exclude you from the 300A. You're sending in all three, okay? Because what you'll see is that Appendix B and Appendix C, they pulled out more specific things in Appendix C. If you were already listed in Appendix B, you're just going to continue to move on with your 300A. But very specific NAICS codes with 100 employees or more have to send in those next two forms, the 300 and the 301. So when you're looking at Michigan's appendices, our Appendix A says if your NAICS code falls under this appendices, you don't have to send any electronic information in, none, okay? This is a exempt list. You don't have to send in any electronic information. If you are on Appendix B, and like I said, it didn't change significantly from the last revision, but a lot of us might fall into manufacturing. Like all the NAICS codes that start with a 31, 32, 33, you're sending in that 300A if you have between 20 and 249 employees, okay? And then we get into Appendix C. So here in Appendix C, if you're looking at Appendix C, they get real specific, okay? So just a couple of examples. Let me move you out of the way. If you are a 3261, a plastics manufacturer, which is not unusual, they're asking for all three forms if you have more than 100 employees, and that NAICS code, that 3261, falls under plastics. If you are a product manufacturer for purchase steel, okay, you fall under 3314, very specific. So if you are a 3314, they want all three forms if you have 100 employees or more, and you are on Appendix C. So unlike these more broad categories where they're like, well, if you fall anything 31, 32, 33, everything under these NAICS codes is going to have to send in the 300A. Now they're being very specific. There's no broad categories. It's saying this NAICS code has to send us all 3 forms if they had more than 100 employees and they're on this list. You have to do the electronic filing by March 2nd of every year, and the data will be submitted electronically to the federal database. MIOSHA does not have their own database. You're going to have to go through the federal system. Oop, I think I skipped one there. Okay. So a couple of things to keep in mind. You do have to have some sort of policy or procedure for your employees to be able to easily report their injuries. You have to be aware of the requirements for the 300, 300A, and 301 during the year record keeping. You do have to have a highest ranking executive officer within your organization sign off on that 300A before you post it. And you do have to post that summary at a minimum from February 1st to April 30th following the year that you just recorded for all of your employees to see. Not on the back of the HR lady's office. It has to be like in a cafeteria near a time clock where everyone's going to be able to see it. Federal OSHA has done a really good job of letters of interpretation. And I encourage you to go to the record, OSHA.gov, record keeping, RK interpretations. This is all of your record keeping interpretations. So there are some very weird scenarios that show up. I get more questions and answers when I give a 6-hour class on record keeping than I think I do in any other class that I give, which is funny. But we have people who have some unique injuries and we have to determine if it's going to go on the log or not. So if you have questions, you can call your consultant. You can call MIOSHA at 517-284-7788. That's the record keeping number. And I can put that in the chat in a minute. Or you can go onto the federal website where they have several hundreds of letters of interpretations when it comes to injury recording. The other thing to keep in mind is that if you are looking for a fact search or any other information on the ITA system, they have also, again, done a very good job of helping you find information without having to call and wait for more information. So use their facts when it comes to looking for what do I need to do to enter my information for the 300, 301, and 300A. Oops. All right, so I'm going to close this presentation so I can open it up to any questions that either you have in the chat or that we can discuss verbally.
Thanks. Yeah, thanks, Deb. We have a couple of them in the chat that can get us started. So the first one is, if someone passes out due to their own medical situation, such as low sugar, is that still reportable due to being loss of consciousness?
Quick, dirty answer is no, unless you told them, no, you cannot have any kind of food or relief for your condition while you're working. Then you've influenced their personal condition, their pre-existing condition. So typically the answer is no.
Thanks. The second question is, to make sure I heard correctly, a parking lot injury counts even if the employee is not punched in. Is that correct?
It is, because you expect them to park in that parking lot in order to show up or to leave from work. That's part of the employer's expectation. So yes, you have control of the grounds, and anything that happens on your property outside of the vehicle is going to be covered as far as reportable. Great.
Next one, if we have a CEO, then they must sign off on the 300A as opposed to the director of HR. Is that correct?
Yes, it is. The highest ranking person in the facility needs to sign off on it.
Okay. Thank you so much, Deb. Really appreciate your time and all of the great information. And thank you all for joining us. Have a great afternoon.